Gentleman from California, Mr. Peters, for 5 minutes.
Thank you, Mr. Chairman, and thank you, Deputy Secretary Hargan, for coming to join us today. One of the challenges in healthcare is keeping premiums down, and I think you'd agree that one of the ways we do that is to make sure we get young people into the pool. Would you agree with that?
There are lots of ways to address those issues with the pool.
I just said, was it one of the ways is to get younger?
Possible one of the ways is to bring lower cost people into the pool.
Right, and you know, we did have a mechanism in the Affordable Care Act, which was enacted before I got here, so I have no pride of authorship. The individual mandate was intended to get people to come in, and now, after you're 26 and you come off your parents' insurance, assuming you have it from them, there's no real incentive to get you to get in the pool. And I noticed that one of the things that the proposed budget would be to cut advertising by 90% and in-person consumer assistance by more than 80%, close to $150 million. Don't you think it would be useful to help get the word out that insurance is available in terms of, as one mechanism at least, to get young people who are healthy into the pool and keep insurance premiums down?
We have seen as the ACA enrollment has developed, we've seen less and less use of navigators, for example, that they weren't really connecting people at some point. We had one result where we had spent $200,000 and there was a single person enrolled by a navigator in one area. That's an area where it seems like there was some waste going on.
I certainly think we should root out the waste. I'll just tell you that California's experience has been at variance with that. California, according to Covered California, and Mr. Chairman, if there's without objection, I'd ask that the Covered California summary of marketing matters be added to the record.
Without objection.
They'll spend over about $111 million on marketing outreach. We're just one state, although we're 40 million people. And they believe that the amount that they've spent has kept premiums down by 6 to 8%, and that if the federal government would go ahead with its 72% reduction in marketing, there will likely be one fewer Americans getting insurance, a less healthy risk pool, and premiums will be 2.5% higher now, higher than they were in 2019. They also say that the premium savings from the expenditures on advertising would yield more than a 500% return on investment for the federal government. We know that getting folks in, if there's no mechanism to do this through requirement like the individual mandate, all we've got is advertising, and it's worked well in California. I don't understand the logic of bringing us to this point.
When we previously had reduced some of the advertising and navigator money, we saw really very little effect on enrollment, and we have seen that private plans had themselves advertised for their own product, and that we were seeing a lot of brokers and agents that had appeared privately to guide people into the plan. So we didn't really see a lack of enrollment, that there had been kind of a period where those navigators and the advertisement that had been done had been useful in the early stages when people were less familiar with the ACA, but now we've seen that really being transitioned into the plans themselves and brokers and agents guiding people.
Again, that's at variance with California, which has had the most successful uptake rates in the country, and I guess I'd suggest we learn a lesson. I wanted also just to comment generally on, someone mentioned the New York Times editorial on Medicaid cuts. That we should work together. I want you to know that I'm someone who wasn't here when the Affordable Care Act was passed. I believe it's a tremendous undertaking to remake the entire healthcare system in the United States. It's going to need tweaks. But it's hard for us to talk on one hand to you about these changes, when on the other hand, the President's Justice Department is out there trying to sabotage the whole thing. It puts us in a very defensive position. And I know this is not something that was up to you. I appreciate your work on the Affordable Care Act, on making it right and making it work for people. But if the administration is trying to cut out the whole thing, it makes it very, very difficult for us to feel like we're in a cooperative mood or feel that we can trust it. Yeah. And I think I ask that you take that back to the administration. Finally, I just point out that your budget would cut funding by $4.5 billion on NIH, National Science Foundation by 13%, This is a devastating blow to biomedical research, particularly devastating in San Diego, where the life sciences industry is a major driver of economic growth, home to more than 1,000 biotech companies, 80 independent research and university-affiliated research institutions. According to NIH, investments in research focused on a particular area stimulate increased private investment in the same area. A $1 increase in basic public research stimulates $8.38 of industry investment after 8 years. A $1 increase in public clinical research stimulates an additional $2.35 of industry R&D investments after 3 years. Have you estimated the devastating impact that these cuts would have on our economy?
Well, we are fully behind the medical research mission of NIH, and we know that the things that are done by the staff at NIH and by our grantee network is very important for the health of the American people.
Well, I suggested that this is extremely counterproductive, and I think it should be opposed. Mr. Chairman, I yield back.
Thanks. Gentleman's time has expired. Now recognize the gentleman.